Scene script. Have you ever wondered what happens in your brain during a stroke? Picture a network of roads, highways if you will. This is your brain's system of arteries. A stroke is a disease that disrupts this network. It affects the arteries leading to and within the brain. There are two major types of stroke. The first is an ischemic stroke, caused by blockages or clots in the arteries. Imagine a roadblock on a highway, jamming up all the traffic. The second type is a hemorrhagic stroke, brought on by bleeding. Picture a highway getting flooded, making it impassable. The damage caused by a stroke can be significant, leading to memory loss, physical disability, and in severe cases, even death. It's like a city being crippled because its roads are blocked or flooded. So strokes are serious business. Understanding what a stroke is provides the first step in prevention. So, what causes a stroke? A stroke occurs when blood flow to a part of the brain is blocked, or when a blood vessel in the brain bursts, causing brain tissue to die. Several factors can lead to this unfortunate event. High blood pressure, for instance, is the leading cause of stroke. When your blood pressure is too high, it puts extra strain on the blood vessels throughout your body, including in your brain. Smoking, diabetes, and high cholesterol are other significant contributors. These conditions damage your blood vessels, making them more susceptible to blockages or bursting. A healthy lifestyle can significantly reduce these risk factors. However, there are risk factors that we can't control. Age, for instance, as the risk of stroke doubles every decade after the age of 55. Genetic predisposition also plays a role, as your risk of stroke can be elevated if your parents or siblings have had a stroke. Knowing the causes of stroke allows us to make lifestyle changes to reduce the risk. But how do you know if you or someone else is having a stroke? Well, the symptoms of a stroke can be remembered by the acronym FAST. Each letter stands for a key sign of stroke. F is for face drooping. One side of the face might droop or feel numb. When the person smiles, their smile might be uneven. A is for arm weakness. The person might feel a sudden numbness or weakness in one arm. They might have trouble lifting both arms and keeping them raised. S is for speech difficulty. The person's speech may be slurred, or they may have trouble speaking or understanding speech. And finally, T is for time to call 911. If someone shows any of these symptoms, even if the symptoms go away, call 911 and get the person to the hospital immediately. Time is of the essence in treating a stroke. Recognizing these symptoms could save a life. If a stroke does occur, what treatments are available? Well, the treatment for a stroke varies based on its type, the area of the brain affected, and the amount of time that has elapsed since the onset of symptoms. The first line of defense against a stroke is often medication. Clot-busting drugs like TPA can be used in the case of ischemic strokes, which are caused by blood clots. These medications work by dissolving the clot and restoring blood flow to the brain. In some cases, surgical intervention might be necessary. This could involve removing a clot or repairing a ruptured blood vessel. Rehabilitation also plays a crucial role in stroke treatment. This can include physical therapy to regain strength and coordination, speech therapy to address language and swallowing difficulties, and occupational therapy to relearn everyday skills. Remember, time is of the essence when treating a stroke. The sooner treatment begins, the better the chances of reducing damage and enhancing recovery. Effective treatment can significantly improve the outcome after a stroke. So, we've learned quite a bit about stroke today. A stroke, in essence, is a sudden interruption in the blood supply to your brain. This can be caused by a blocked artery or a burst blood vessel, and the resulting lack of oxygen and nutrients can cause brain cells to die rapidly. We've also discovered that the symptoms of a stroke can vary widely, but often include sudden numbness or weakness, especially on one side of the body, confusion, and trouble with speech and coordination. When it comes to treatment, the faster the better. Immediate medical attention can help limit the damage and increase the chances of a full recovery. We've also underscored the importance of a healthy lifestyle in reducing stroke risk. Regular exercise, a balanced diet, and keeping blood pressure and cholesterol levels in check can all play a significant role. With knowledge and awareness, we can all play a part in reducing the impact of stroke.